Okay, great to see you.
Hi.
Hi. So it's been, I guess it's been what, just a little over a week since you had an operation.
Yeah, last Wednesday was my surgery. So about this time, 8 days ago, I was being wheeled out of recovery.
That's right. Okay. And so you have or had an olfactory groove meningioma.
Keyword had, yes.
That's right. And I received a call from a physician in the Atlanta area about your problem.
Yep.
And I don't remember if he or you sent me the films for my review, but it showed this olfactory groove meningioma with a lot of swelling or edema in the right frontal lobe. But you told me that it was basically an incidental finding for another reason. And then you made a decision to come here for surgery. So maybe tell me just a little bit about that and how the experience was with surgery.
Oh yeah, exactly right. I had a CT scan for a random jaw cyst that I've had now 4 times. Nobody can seem to get rid of. And this particular oral surgeon said, you know what? Instead of x-rays, let's get a CT scan. Fine. Well, I log on and to see how big it is and whatnot. And it's an incidental finding of a brain tumor. If that's not mind blowing. So yes, our mutual friend, who's a radiologist, I sent the, he was my first call, and I said, what on earth is this? So we went in, got the MRI without contrast, and he told me you need to get 3 or 4 discs. I guess that's what you call them, the CDs, right? And I sent one to him, and he called me on a Saturday and said, this is what you have. And he put me in touch with a doctor here in Atlanta, a neurosurgeon in Atlanta who I spoke to. And he said, I also want you to call Dr. Sekula in New York City. So I did. And I sent you I emailed you on that next day, that Sunday. You emailed me right back and had me send the disc. We had a conversation via like a telehealth call that Thursday. And whereas everyone else I'd spoken to said, everybody was in full agreement, needs to be taken out, swelling, edema, blah, blah, blah. Even though I was what I thought asymptomatic, they were all going to do the what do you call it? The zipper, right? Cut me right here and go all the way across my head and shave my head a couple inches, because that's the look everyone wants going into the holidays. And and every neurosurgeon said, oh, we can get it all out, but it was to me very invasive. I kept thinking, if it's just right here, a little over 3 millimeters, if it's just right here, why are they centimeters?
Yeah, 3. So it's considered a medium size.
It's medium size. I'm very
average. Most of the tumors we treat for individuals like you are more in the, they're 0 to 3 centimeters is considered small, 3 to 6 is considered medium, and over 6 is considered large. Pretty much anyone over 6 is going to be very symptomatic. Usually they're very lethargic, maybe have lost some inhibition, often have gained a lot of weight, uninterested in activities that they formerly were interested in. And then between 3 and 6, they're starting to develop symptoms.
Okay. Yeah. Well, I believe 3.1.
Yeah.
So I was on the low side of normal. And yet still, I was having a hard time with the layman's term, peeling off of my forehead and carving my whole forehead bone out and go, it just seemed very, for a 3.1 centimeter tumor. And our mutual friend, our radiologist friend, said, no, Dr. Sekula, he does this supraorbital eyebrow thing. And I thought, well, good Lord, let me look into this. And I did. And then we spoke, and the rest is just history. I couldn't get in there fast enough. Honestly, I think from the time you and I spoke on that Thursday, Caroline then got me, you guys encouraged me to think about it overnight, and no decision needed to be made right away, which I agreed with. And within about 10 minutes, I emailed Caroline and said, I need to know his next available appointment. And I was in on November 2nd. I think it was 2 weeks, a little under 2 weeks that we had the phone call, and then I was having my head
That's
loving.
great. It's fun to see you've done really well. These are almost always, as we discussed, benign tumors. And, we'll have to follow it and make sure that there's no small evidence for regrowth, but I think it's probably unlikely. If there is, it wouldn't require another operation. It would just be a one dose of radiation. And how are you getting about your activities and things now? Are you
Fine. I walk just about, it's Atlanta, so we're still kind of a little more temperate. So I get out and walk, either with James, my husband, or with my daughters, about 3 miles a day.
wow.
Yeah, not nearly as swiftly as probably I did a month ago, but I walk it, and Atlanta's, people don't understand, it's very hilly here. And when I first got home, I would find myself, just kind of nodding off a lot. That lasted, I flew home. So the surgery was Wednesday. I flew home Saturday morning, and, gosh, I probably napped Saturday, Sunday, maybe Monday. I mean, not that I don't want to, I'm just not feeling the need to overwhelmingly put my head down and go to sleep anymore. It's just not happening. It's actually kind of nice, because I'm telling everyone I can't work, and I really can't work and deal with people, but yet here I am getting my hair done.
That's great.
Yeah.
Well, I'm glad you've done so well, and it's great of you to share your story with others.
Well, here's the thing. Anybody, I don't care who you are, you hear you have a brain tumor, somebody tells you that, you're going to panic, and you remove the dang things. It is, I had no idea that these meningiomas are, I mean, not that everybody has them, but they're not uncommon, and they're not a death sentence. And much of the time, better than I do, you don't have to have your entire head cut open. You went through my eyebrow. I know other patients where you've gone behind their ear, and it just takes a little bit more education, and, in my opinion, at least for me, education and work, and a little more sweat equity on the front end to figure out what your best path is. Because listening to the first doctor, or second or third or fourth, who says, yes, this is what you need to do, a lot of times, like in my case, it's because they don't do the supraorbital procedure, and that's okay. That's okay. But I was just so thankful that I was led to you, and we could go that route.
Yeah.
So I'm happy to share my experience with anyone and everyone, because hearing those words, you have a brain tumor, you've already got one foot in the grave in your own mind, Yeah.
Well, great to see you.
Thank you.